Hello and welcome to another TGIF episode of the Aunty Pharmacist podcast. I can't believe it's another Friday already. I know I've been saying how time flies a lot lately, but guys, it can't be overemphasized at this point. Monday was just like yesterday, and here we are again on Friday. Wow. Well, the topic of discussion today centers around one of my pet peeves in the pharmacy. I don't know if it's just me or my other colleagues, other pharmacists like me, also see it as one annoying thing that some people do when they come to the pharmacy. But, well, I will share it. And if you have been doing that in a pharmacy, I would advise that you stop because it's actually not nice, okay? You know what I'm talking about? Well, the topic is shoppers in a pharmacy. It sounds funny or strange to you, right? Well, I will explain now. Let's get right into it. You know, when it came to my mind, I was looking for a way to frame it, and this is the best way I can put it, guys. Like shoppers in the pharmacy. I will explain in just a minute, okay? So, the real reason why I'm bringing this out here is that I want to make some corrections on some things that happen in a pharmacy, or should I say that some patients do in a pharmacy. First of all, I know most pharmacies come with stores, as in you see pharmacy and stores in the name, but it is still primarily a pharmacy, Although there are pharmacies that have distinct sections for their store or mini market, as you may like to call it. But the truth still remains that pharmacies are different from supermarkets, as in a pharmacy is separate from supermarket. Even if a premise is pharmacy and stores, you can't find medications and maybe cosmetics or supermarket items side by side. Each product has its own section in the same space. You get my point, right? Having a supermarket section in a pharmacy is just a bit to bulk up sales, and make it a one-stop shop of a kind, and sort of make it easy for you to get other items at the same time you're getting your drugs if possible. Having said this, I see no reason why a customer or client should act in a pharmacy as if in a supermarket. The customer or client nomenclature is a blanket term, but the more specific term for patrons of a pharmacy are patients. So you see me say patients all the time, because these are people that come, to get medications for their ailment or ailment of a loved one, right? So it doesn't sit well when a patient or client comes in and starts pointing to medications as if you're shopping for them, or when you want to go past some boundaries. There are some places that you should not go to that are out of bounds to non-staff, but some patients, they like to do, I too know. Some will even want to see the pharmacist and they will almost enter you. You understand? And you have to tell them that, please, you are supposed to stay here while we talk, face me. And they will give you attitude with it. No, sir. You are not in a supermarket. You are in a pharmacy. Even if it's that your neighborhood pharmacy that you enter almost every day. Still, please, maintain some etiquette. There are some rules that you have to observe in a pharmacy. If you enter a pharmacy and store, you see shopping baskets around, please be advised that the baskets are for the supermarket products, not for medications. So you cannot pick up the basket and start putting medicines inside them. I get that pharmacies have various floor plans. Some arrange their products freely and within reach of anyone coming in, while others arrange products on shelves behind certain counters so that only pharmacists or authorized persons can reach them. There is no specific standard of arrangement per se. Whatever kind of arrangement is adopted by the pharmacy which you are going to, you should walk up to your pharmacist to make your demands. Some will come in and start pointing around, asking the pharmacist to pick up the product as they are going. Please stop it. I even know what caused that one. It is over familiarity with the shelf arrangement of medications, Abby, and plain labeling of the shelves, because they label this one cough medicines, they label that one home remedies or something. So you believe that, okay, I will just have to walk to the cough medicine section and pick whatever cough medicine I like. No, it's not like that. This labeling of shelves is more for order, that is to make the product easy to locate by the pharmacist and not you. and sometimes for aesthetics, to make it look good, for orderliness, not for you now to be shopping as if in a supermarket. Let's not even get into drugs that look alike or whatnot, or how your pharmacist can help guide you in choosing better medications for your condition. It won't cost you anything to ask first instead of stretching your hand to pick medications, especially on top of shelves. I don't know how to explain this. Maybe because of the setting of my own pharmacy, there are shelves that are almost at chest level of patients. Then there are drugs behind them. Some will reach past this and want to pick medications when they haven't even seen the pharmacist. Some will just come in and come, pharmacist, come. This one, that one. Pick this, pick that. It rubs me off wrongly, and I don't think it's the right thing to do. Really. The right thing to do is to walk up to the pharmacist and make your demands, not go to the shelves and start picking products. Some go as far as stretching to pick products. I know that some people do not actually know the names of their medications. All they know is how they look. And I've addressed this in the last episode about knowing your medication. So, you should know the name of your medication. And if you don't, take a picture, like I've said in the past. If you want to know more about this, just listen to my episode titled Know Your Medication, so that you can communicate better with your pharmacist. Just tell them, okay, this is what I use this thing for. This is the picture. They'll pick it for you. Don't do as if you are the one that put the medications there and you are going to stretch your hand to pick it. What if you are caught in camera and you are taken as a thief? Now you know that one. No? Some will say, what if I want to read the instructions or the information on the product before buying? Who says the pharmacist can't hand them over to you? And you even get to ask the pharmacist some questions in the process. I know you know what you want to buy. You even know where it is arranged on the pharmacy shelf. But please, approach your pharmacist or authorized persons to ask for it, and they will bring it to you. Don't blame anyone if you are mistaken for a thief while you are shopping for your medications. A word is enough for the wise. So a random thought, guys. I just thought, how short this episode is, and how when I started out on the podcast plan, before I even started airing, I planned that each episode should be about 15 minutes long. And I wanted to maintain this so much. So sometimes when I record some episodes and they are less than 15 minutes, I'd be like, I have to say something more just to make it up to 15 minutes. But then after listening to a fellow podcaster from the US, I think she said something significant that stuck with me. She said that build a recipe and not a statue. So this podcast is a means to actually grow my creativity, let you in on my experiences as a community pharmacist in Nigeria. And don't be surprised if some topics do not even have anything to do with drugs, if they are not medication related. It's just a creative space. So I've learned to just enjoy the process, share with you what I'm thinking per time as it comes, and not put myself in a box. Alright? So that's just that thought that has come to me right now. It doesn't have to be 15 minutes. It can even be 5 minutes. As long as I've passed my message across and you've enjoyed yourself listening to me, I think I'm fulfilled and it's just fine. And on this note, I bring this episode to a close. Remember, please, to follow, to share, to like, and subscribe to this podcast. I always say the most important one is sharing, because I know that there's somebody that should listen to this podcast, and you know that person, so why not share with them? Well, for those that have been listening, that have been sharing and following, I thank you so much. Thank you for supporting me up to this point, and for you that will share after listening to this episode, thank you as well. Your support means a lot to me. So till next time, stay healthy and God bless you.